My name is Nahid, and I'm here with Lexi and Peyton, and we are presenting on right cerebral vascular accident. A cerebral vascular accident is also known as stroke. It occurs when blood flow to a part of the brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrition. And it makes the brain cells die or have damages on them, making them a medical emergency. So today we will be talking about the diagnosis overview, assessments, and treatments that are available for stroke. So some of the physical common changes are left-sided weakness or paralysis, diminished or absent sensation on the left side, left-sided neglect, usually unilateral neglect, and then there will be some visual issues, and then there will be some spasticity or abnormal muscle tone. Some of the cognitive and emotional changes. On the cognitive part, there is going to be poor insight and impulsivity. There's going to be attention deficits, spatial disorientation, and left-sided inattention. Some of the emotional changes are quick and imprecise behavior, irritability, and lack of concern or motivation.
Our first assessment was visual field testing to test left visual field cut or left-sided neglect. This is a good assessment for right CVA because they may lose part of their left visual field or have left-sided neglect. It can help diagnose if there is a true visual field cut or decreased awareness on the left side of the body. OTs can then work on increasing awareness of the deficit and focus on the neglected side to improve safety. Our second assessment was the KF-NAP. We chose the limb portion because it can allow OTs to observe the patient throughout the session and focus on how much the patient attends to their affected side. This can be beneficial in right CVA patients who may have significant weakness in the left arm and leg, but they may ignore the limbs or have decreased perception of the affected limb. Our third assessment was the CARE. We chose the functional status section A, core self-care. This includes eating, tube feeding, oral hygiene, toilet hygiene, upper and lower body dressing. This is a great tool for right CVA by assessing their functional status of ADLs after they have had the stroke, and OTs can get a good idea of how to treat their patient by looking at their functional status.
Our first intervention is constraint-induced movement therapy. Constraint-induced movement therapy involves restraining the unaffected right hand and having the patient use their affected left hand to perform grooming tasks like brushing their hair, washing their face, brushing their teeth, or anything else they would like to do with that grooming. The rationale is it forces the patient to use the neglected side in their affected limb and promotes neuroplasticity in the brain to regain the neural pathways to improve motor control of that affected limb. Our next intervention was mirror therapy. We would set up a mirror on their left side during meals to help facilitate awareness of their neglected limb so that hopefully we could regain some movement. The rationale is mirror therapy helps bring awareness to the neglected left side and provides visual feedback to help compensate for their loss of attention or sensory sensation on that left side, leading hopefully to better outcomes. Our third intervention is playing the Wii with both hands. What to do is we would have the patient play games on the Wii of their choice that involve using both the affected and unaffected upper extremity. The rationale is this will encourage bilateral upper extremity movement and coordination. It is also a repetitive task that is enjoyable, that will give visual and auditory feedback for the patient, and that promotes attention to the neglected left side. It's also a fun activity that can just boost morale during therapy with the patient.
Here's our references. Thank you for listening.